A very warm welcome to all of you joining us today to this week's edition of The Spotlight. Now, when I started off by saying warm, I meant it quite literally as well. Now, the heat in Sri Lanka, in some parts of the country, are on the rise. Along with this, we also see the rise in skin-related issues as well. So we have with us Dr. Indira Kahawita, consultant dermatologist of the National Hospital of Sri Lanka, to discuss the importance of skin health during this extreme heat in some places of the country. Doctor, thank you very much for taking the time. I'm sure you're very busy, especially this week, also with everything going on. So thank you for joining us today.
Yeah, thank you for the invite.
Definitely. Doctor, now El Nino, as we all know it, it's a phenomenon. Just before we started, you said that's not your area of expertise, but just give us a brief idea of what this is all about.
Simply put,
Yes.
it's a heat wave,
Yes.
and actually what we are experiencing is the temperature is high, and being a tropical country, the humidity is also high. So what we feel is, with the high temperature, we have an increase in sweating, but with the humidity of the environment being higher, the sweat will take longer to evaporate. So there will be a fairly hot, humid environment on your skin. In addition to that, the UV rays are also stronger. So roughly the UV index will be higher during these times of the year. So those are the changes that are happening. So those changes will be affecting our health, our skin. So that is what we are going to discuss.
Right, Doctor. Now, the Met Department has also said that the heat index is at a caution level for the human body. Sometimes we also see the heat going up to about 36 degrees, 37, 38 or so. It's quite hot if we talk about it in simple terms. And they also said, the Met Department also mentioned in a statement that this weather, the El Nino phenomenon, will continue until April or so. So we have a month left. And even if it rains, they said the heat will still not decrease. So how is this extreme heat going to affect the skin condition of the people in certain areas experiencing this weather?
Yes, so as we discussed earlier, the issues are the high heat, humidity. Therefore the condition over your skin will be that there will be a lot of sweat getting collected, so there will be a humid environment on your skin, and the high the strong rays of the sun. So the effects will depend on those. So if we take the effects of the strong sun, the UV effect on the skin first, so that is the effect of the direct action on the skin. So there are a group of people who will develop sunburn, acute sunburn. So if especially during a time like this, say again we get a long weekend coming, you go on a trip, you go for sea baths, you are out there in the sun, you are out in a pool. So if you spend a few hours out in the sun, you are liable to get sunburn. So if you plan to spend a lot of time outdoors, you have to make sure that you use sun protection properly. So sunburn can happen, but most of us who have brown skin, darker skin tones, more than sunburn, we will get suntan, right? So you will get
confusion there.
Yes, I mean, tan is you get darker.
Right.
So for somebody like me who is quite with a darker skin tone, I'm more liable to become suntanned than get sunburnt, right? The sunburn is mostly seen in people who have a lighter skin tone, even amongst us. But whether it is lighter or darker, if you spend a lot of time, especially something like a sea bath, then you are liable to get sunburnt, right? So then what happens is you get blisters on the exposed areas of your skin, and then after a few days, there will be sort of burning sensation. You may get either blisters or pustules, and then after some time the skin starts peeling off.
peeling off.
Peeling off, because the blisters will peel off, right? So that is sunburn. Suntan is you get darker, but in addition to that you get what we call sun rashes or sunspots. So if you talk about sunspots, it's much commoner in children, especially children from, let's say, 7-8 years, from 7-8 years up to about 12-13 years. So those children, especially if they have a drier skin and if they are out in the sun, they get these white spots on the upper part of the cheeks. They are usually symmetrical and they are kind of fading into the surrounding skin, several patches, and there may be a little bit of itching. So that sort of patches, those we call sunspots. They are due to the direct effect of the sun on the skin. So they will not cause any permanent damage, but I mean, especially these pre-teen children, they may be worried about their appearance, right? So the best you can do is, okay, if they want to be out in the sun, that's fine, but they have to use sun protection.
Doctor, just to pop in a question there,
Yeah.
now there are different skin types, dry skin, oily skin, so on and so forth. There's also a misconception, or correct me if I'm wrong here, that if you have oily skin, you don't have to use a moisturizer or a SPF. Is that true? Or does it SPF applies to all?
Yeah, let's come to that in a minute.
Yeah.
Because I'm going to talk about sun protection here, because I talked about sunspots, and there's this other thing called sun rashes.
Right.
They can be a little bit more extensive, especially in areas which are not covered by your clothing, so the outer part of your upper limbs and maybe the front of the chest, right? So those areas. So you get these itchy, a little lighter than the surrounding skin, itchy rashes. Usually again it's symmetrical, right? It can occur on the face as well. So these patches, like you get a lot of patches along your forearms, right? So those are extremely itchy, and the itching may be worse at night. So if those things occur, we need to take treatment to soothe those as well. Then coming to what you can apply and what you cannot apply. Right? So I said most of these things occur if your skin is dry, right? So that way, yes, a lot of people need moisturizers. So when it comes to moisturizers, there are a few things we need to remember. Especially, you were talking about oily skin and dry skin.
Yes.
So a lot of us have dry skin in their trunk and limbs, but the skin on the face is usually oily. So in that case, you cannot apply the same moisturizer to the body and the face. If the skin is really oily, the face, you don't need moisturizer. You can escape without using a moisturizer.
Right.
But if your skin, especially the body, the skin is dry, you need a moisturizer. So again, a lot of our patients now say, doctor, I can't apply creams because I start sweating.
Yes.
So a practical way out would be to use a moisturizing lotion. Because lotions are a little bit different from creams. Creams are more sticky and thick, but lotions are more kind of a semi-solid fluid. The fluidity is more, therefore it's easier to apply. And if you are applying a moisturizer, the best time to apply is just after you wash yourself and dry, like immediately after washing. Then the moisturizer gets absorbed nicely and it gives its effect far longer than usual, and you need less moisturizer as well. Then you were talking about sunscreens or SPF. So moisturizer and sunscreen are two different things. Sometimes you may get moisturizers with an SPF value, but that sun protection that you get in a moisturizer is not good enough. Because usually in a moisturizer you will get a SPF value of about 5 to 10. But we are talking about an SPF value or sun protection factor of 30 or above. So you need a sunscreen. So when it comes to sunscreens, especially for young people with acne prone skin or oily faces, there are specific sunscreens which are meant for that sort of oily face. So you can't go for a greasy sunscreen for the face, but you can use a greasy sunscreen for the rest of the body, right? Again, there are a lot of things people need to know about sunscreens. One is the SPF. The second is when and how to apply. The best way to apply sunscreen is you have to apply it about 10 minutes before you go out in the sun. You have to apply a fairly thick layer. It's not like applying your moisturizer,
Right.
because actually the action expected here is the sun rays of the sun to be reflected. So you need a smooth, somewhat reflective surface, right? Therefore, you need to apply the sunscreen in a somewhat thick layer. Then the issue comes, for most of us with darker skin tones, it shows.
The white
So,
cast.
yes. So, it's not cosmetically acceptable to most of us. So, people are not very happy to apply. Then, if you are out in the sun for a very long period, you have to reapply every 2 hours. Right? So, and you need a fairly large amount of sunscreen to do this.
And it's not it's quite
Definitely,
expensive as well.
it's expensive. It's expensive because all over the world, sunscreens come as cosmetics. And cosmetics, all the other financial things, the taxation and all, so cosmetics are costlier than medicines. Therefore, sunscreens are somewhat expensive. So, what are the other things that we can do? If you cannot afford sunscreens, what are the other things you can do? I think the first thing should be, like, you should make sure that you don't go out. You try to avoid extreme sun, especially from 10 a.m. to 3 p.m. Like, if you can avoid, do avoid. Try to stay indoors. If you cannot, try to cover your body with your clothing as much as possible, right? So, if you can have a cotton shirt with long sleeves, I mean, wear it long by all means and cover your body, because clothing is the best sun protection, right? If you cannot do that, there are all these other gadgets, like, what's called inners and all. There are these things that you can, pull over your, even whatever you do, wear. Even with a sari, you have these things like this tube kind of thing that you can pull over your uncovered area. Then, of course, there are things like sun hats and umbrellas. Right? So, depending on your circumstances, you can try all these physical methods in addition to or instead of sunscreens. So, whatever it is, the idea is to try and avoid direct sun on your skin as much as possible.
Yes. Now, Doctor, the Ministry of Education had also released a few circulars in the past few weeks to schools saying, do not have your sports meets, postpone it. There is a reason for this, right? Because the children are expected to also be kept indoors. Let's talk a little bit about this as well, because some people think children have to be in the sun for long amounts of time, but I don't think that's the case with the heat coming in.
Yes, I think now especially the Ministry of Health gave the warning, actually it's the Ministry of Health initially who released this warning, saying that people should stay indoors because of the heat wave. There's a reason for that, because there is a condition called heat stroke. I'm not the expert to talk about it, but heat stroke can occur. But in addition, I mean, there are these other effects on the skin. So, if we, think about what we can do regarding children, I think, okay, now, what's happened is schools have been advised to postpone their sports meets. But then, what about sports practices leading on to the sports meet? So, my suggestion is, like, for schools, one, you can start your sports practices early in the morning, right? Don't wait till 8 o'clock. start it early and try to finish it by at least 8:30, right? And like maybe don't do sports practices every day, like you can phase out because now you're going to have the sports meets a little bit later. And also make sure that the children drink a lot of water. Here again we'll come to that later about whether water is the best thing to drink. And also make sure that the children use protective gear, either a sunscreen or, I mean, this is not only the children, even for teachers it matters, right? Because yes, okay, children should be allowed to, you know, go out in the sun, get used to the sun, but when there is a risk of heat stroke, when the weather conditions are extreme, I don't see any point in our, you know, sending our children to the out in the sun, keeping them for very long periods. And you know, a rule of thumb I would suggest here is, for anybody, if you find it very difficult to tolerate the sun, don't try any heroics. Come back indoors.
Yeah.
Right? So if you cannot tolerate, don't try things, because it's not worth it. Right?
Well, doctor, you had also mentioned in a few statements, back to back, I think on 2 consecutive days, that there is a rise in skin-related diseases. And we also saw a rise in the ringworm disease, fungal infections and more. What are your thoughts on this?
Yes, again, now we initially discussed the top of the skin. Now with the sweat and the humidity, there is quite a moist environment on our skin. It is seen more in areas where the sweating is more, what we call flexures. The armpits, groins, under the breast, those areas. So in those areas, when there's a lot of collection of sweat, fungal infections, the environment is more conducive to fungal infections. So people may get fungal infections, what we call ringworm. Actually, not only with this weather, but we have been seeing a rise in ringworm recently over the past 5-6 years. Actually, we don't have exact statistics to say there is a rise, because, you know, ringworm is not a disease where we collect statistics. But we see more and more people are getting affected, and also the extent of the disease. So earlier we used to see 1 or 2 lesions which would respond very nicely to 1 or 2 antifungals. But now we are seeing people having lesions on their faces, trunk, everywhere, not only the flexures, and several members of the family getting involved, affected, and the disease not responding well to our usual antifungal medications.
That means it's spreading.
It is spreading and it's becoming an issue, especially if a disease is not responding to your usual medications. That means
Why is it not responding, doctor, to normal medicine?
There are several reasons. The first reason is, now especially now we said the ringworm infections are more commonly seen in areas which are usually, you know, we call our private parts. And a lot of our patients are quite reluctant to go to a doctor and show the rash.
Right.
Get themselves examined. Therefore, what they do is, it's very easy, and like, you know, in Sri Lanka, even though the rule is that nobody can dispense any medications without the prescription of a doctor. In Sri Lanka, prescription only medicines are also dispensed over the counter by pharmacies. It's happening, right? So what happens is, people would go to a pharmacy and say, please give me something for an itchy rash. So unfortunately, we have this called triple combinations. We have a steroid, we have an antifungal cream and an antibiotic, a combination of all three. So these triple or double combinations always have a steroid there, right? Steroid has anti-inflammatory properties. So inflammation is when you get itching, when you get redness, when you get swelling of the skin. So those are the things that give you the symptoms, the itching. So when you apply an anti-inflammatory cream, you get an immediate relief. Your itching goes down, the redness goes down, so you think, yes, I'm getting much better. But when you use a steroid on your skin, the skin's defenses go down because you reduce all those. The immunity of the skin goes down. Therefore, the infection, although apparently okay, it's spreading, right? So that is one reason. The indiscriminate use of combination creams. The second reason is, recently we have done an island-wide study on the organism causing ringworm. It's changing. It's changing to a more strong and virulent organism. And the most recent evidence worldwide is there is a further change in this organism, and that particular organism has very strong properties, and it is very poorly responding to most of our treatments, antifungals. Most of our conventional antifungals will not respond, will not be strong enough to be against this organism, right? So the change in organism and indiscriminate use of treatments. Those are the two reasons for this phenomenon that we are seeing in fungal infections at present.
Alright, welcome back to the show. So doctor, just before the break we were talking about fungal infections, ringworm, and all things causing and increasing during this time frame with the heat wave in Sri Lanka. Let's talk about some common symptoms that you see before these fungal infections come into much visibility on our bodies.
Yeah, so it usually starts with a little red patch, itchy, usually in an area where there is increased sweating, so let's say groins or the armpits, and it spreads outwards like a ring. That is why it's called ringworm. So it would start like a small patch, and then it would, like this, it will spread out with clearing in the center. And then there will be several of those coalescing together to form a large rash. So if we start early, and if you use an antifungal, a pure antifungal, not a combination, you may be able to contain it and get rid of it very quickly. Usually what happens is you need to use antifungals for a long period, 4 to 6 weeks, and like usually what happens, patients, the moment they get better, they will stop their treatment, right? So regarding antifungals and treatment of fungal infections, my advice is, please go to a doctor if you have these sort of symptoms. Itchy, scaly, red rashes which look like rings, especially in sweaty areas. Go to a doctor. Please don't, try to use what your neighbor used or what your pharmacist gives you. No, don't do these things. Go to a doctor. If it is just 1 or 2 patches, your family doctor is good enough. But if you are not getting better with your family doctor's treatment, our advice is, please go to the nearest hospital where there is a skin clinic and get your treatment from there, or else go to a dermatologist. Because most of the times what we see is people using one cream after the other, trying a lot of things, and then coming to us when the infection is really extensive. Then the duration of treatment, the cost, everything goes up. So even if you go to the government hospital and get the treatment, the cost to the country and indirectly to us is massive, because most of the oral antifungals that we are using are quite expensive, right? It may be that you are not paying out of your pocket, but still what you get from the government hospital has been paid for by us, right? So therefore, we have to always make sure that we get to take proper treatment and use it for the prescribed period of time, and you follow the other instructions given by your doctor.
That's true, doctor, because a lot of people wait until things are beyond control
Yes,
to go to the
yes,
doctor
you
instead of
shouldn't do
nipping
that.
it in the bud.
You shouldn't do that, especially in the case of fungal infections, tinea.
All right. So, doctor, let's talk about self-medication. You were also mentioning it just a little while ago. Let's break this myth where people think, oh, this person is following it, so it will definitely work on me as well. But we're talking about skin here. It's not a joke. So let's break this myth where each person's skin is different. And it's important that we go to a doctor and not worry about social stigma and worrying about being shy and all of that.
Yes, especially when it comes to skin issues, like a doctor who knows about skin issues should be able to diagnose without much trouble because it's visible, right? I mean, it's there for you to see. There are no high-end tests needed to diagnose a skin disease. So what somebody has to do is go to a doctor and get a proper diagnosis. So if you start a treatment with a diagnosis intact, then you know, okay, I'm getting treated for this. So self-medication is, I mean, most of the times what happens is, especially with these combinations, most of the general public, people who run pharmacies, and even some doctors tend to think that when you use a combination, all three components will work. Therefore, if the antifungal is not working, the antibiotic will work. But usually, the strongest action is in the steroid. Therefore, in the end, what will happen is the rash will change its look so that it will be difficult even for a dermatologist to diagnose. That is the issue of self-medication. The other kind of self-medication we are seeing in Sri Lanka is, I wouldn't call it self-medication, but the use of skincare products, right? We have to discuss about the safety issue, right? There are thousands and thousands of skincare products in the market in Sri Lanka, and most of these fall under the category of cosmetics. Therefore, they are not at the moment there is no law making it compulsory to register or regulate. Therefore, there is a huge number of unregistered, unregulated products which are used on the skin. The really dangerous part of it is, sometimes you may be using it as a body lotion. You may believe that this is just a body lotion, I am using it to treat my dry skin. But it may contain harmful products because these are not regulated, and so I think the best thing somebody can do is, if you are buying a product, look at certain basic facts. Has this been registered somewhere? Does this have any standards like SLS or ISO, right? Does this carry a label saying this has been registered under the NMRA, National Medicines Regulatory Authority? Or has it been registered in some other country? And does this carry the certain important things like who manufactures, the address and contact details of the manufacturer, address and contact details of the agent in Sri Lanka, the date of manufacture, date of packing, date of expiry, and what it contains. And all these have to be given in a language that we can read. So it should be either English, Sinhala or Tamil, not in Arabic or Chinese. Right? So if those are there, and also please see whether there is a batch number, because fake products are also there, right? And if you run into some trouble, and if the authorities try to press charges, if you have used a fake products, there will not be anybody to take responsibility of this. So all these you have to check before you start a product. And here again I would like to ask you, please don't try to mix a lot of creams together and make a day cream or a night cream or a whitening cream on your own, or don't, you know, buy things which doesn't have a name or any label. Because there are, this production of whitening creams and skincare products is becoming like a sort of a cottage industry.
Yeah.
Right? So don't buy these things, because nobody will be responsible for what happens to you, especially in a time like this. It's important because most of these products, the unregulated products, may contain things that, you know, sensitize your skin to the sun. Therefore, the moment you apply these and go out in the sun, you will end up with a lot of white spots on your face and body. Especially if usually if somebody comes to me with white patches from, let's say, forehead to the chin all over the face, the first question I would ask is, just tell me what are the skincare products you are using. Because usually the sunspots I talk to you about, they usually occur in the upper face. Right? Okay. But if you have used something that sensitizes your skin to the sun, it occurs from here to here, pan-facial. So if you get white patches pan-facial, the first question we would ask is, please tell me what you applied on your face. It's that extent. So when you are using products, be very careful. And if you are using, let's say, we can't ask you not to apply anything, but if you are using any products, especially what is called these day creams and night creams, especially if you think about whitening, please make sure that you use sun protection. Please make sure that you use a good SPF 30 or above sunscreen in the morning.
Doctor, now we've also talking about the doctors and all of that in Sri Lanka. Let's talk about the medical sector. How well is the medical sector equipped in Sri Lanka to handle this heat wave and the patients coming in? Because we also see specialists leaving the country. We see a bit of a shortage of specialists. How are we faring?
Right, okay. When it comes to dermatologists, yes, we have had a few of our colleagues leaving, but so far we have been able to, maintain our island-wide service. Right, so when it comes to manpower, I would say we have a shortage, but we can manage. But when it comes to medications, it's not that we have a very acute shortage, but you see, the higher the occurrence of fungal infections, the higher the need for antifungal medications, which are costly. Right? So, for the government sector, there may be times that we have shortages. Even if there are no shortages in the government sector, like if somebody has to, if somebody goes to the private sector and buys it, it's going to be quite costly. At the moment, we are not facing a shortage of antifungals, but when it comes to things like sunscreens, yes, in the private sector there are enough sunscreens, but in the government sector, we don't have these commercially prepared sunscreens. We prepare our own sunscreens in our clinics. We may be able to prepare it, but practically application of these sunscreens is an issue, because with the sweat, these somewhat, our clinic prepared sunscreens are not practically, very easy to apply. They're not very user friendly. Therefore, our patients don't like to apply it. Right? So that is there. At the moment, we are not facing an acute shortage of things, but it's always better to be, careful about skin care rather than wait for things to go out of hand.
Now, doctor, there are long-term consequences of overheat exposure and overexposure in the sun, and being in the sun for prolonged amounts of time. What do you think are some of the long-term consequences that we see, whether it is in terms of children when they are at a very young age exposed to very high amounts of heat, how will that affect them in the future?
Yes, actually we have this idea that children have very resilient skin, but when it comes to skin cancer, we know that skin cancer is not a very big issue in Sri Lanka,
Really?
right? Yes, because of our brown skin. Right? We are protected from skin cancer because of the melanin that we contain in our skin,
Yeah.
right? But still, for skin cancer, the risk is the sun exposure, high sun exposure during the first few years of life, first 7 years of life, right? So, when I say that, I'm not asking parents not to allow their children to go out in the sun. No, it's nothing like that. But I mean, it has to be a somewhat controlled sun exposure. More than that, I think the long-term effects are like this. Now, let's say skin aging, right? Skin aging, there are two types. We age because of our age, our age in number, what we call chronological aging, right? So, a person will have certain changes in their 40s and a little bit more in their 50s likewise. But in addition to that, there is what's called photoaging, right? So, aging due to sun exposure. So, the person who has more melanin has better protection against photoaging than the person who has less melanin, right? So, somebody like me who has a fairly dark skin has a better protection against photoaging than someone who has a very fair skin, right? So, here comes the trick, the catch, right? Because a lot of us now are trying to make our skins look lighter. Right? So, if you want to make your skin look lighter, you have to always remember, I'm going to look older quickly. Therefore, I need to use sun protection. Right? So, that skin aging will be, early skin aging will be an issue for a lot of us because people are trying to change their color. Again, when it comes to skin cancer, I told earlier also that skin cancer is not a very big issue, but if you look at the statistics from 1985 to 2020, that is 35 years, the skin cancer incidence in Sri Lanka has about tripled, right? The reported skin cancers in Sri Lanka has tripled.
Until 2024, there must be
yeah, I think we have data up to 2021, right? So, that is the natural increase in skin cancer. Maybe there is increased detection and also increased incidence. I think up to 2021, the skin cancers that occurred had nothing to do with all this change in skin color. So, when we say when you change your skin color, when you want to become whiter, the protection, your melanin goes down, your protection from sun goes down. Therefore, theoretically, there is a risk for skin cancer there as well, right? So, we need to remember all these things, right? So, the effects of the sun are not only short term, they can be long term. For the long term consequences, I think the best thing we can do is allow nature to take its course. You were born with a very good brown skin with enough melanin to combat the effects of sun. So, please preserve that, right? So, you have a very good screen protection on your skin by way of melanin. So, the best thing is to protect that rather than damage and destroy that.
So we are on the final lap of the spotlight this evening. So much to talk about, so much information that we have to discuss. Dr. Indira, we were speaking on exposure in the sun for children and in terms of that. But there is also another issue that we see, correct me if I'm wrong again, it might be a misconception, it might be an issue. they say stay indoors, right, during the heat, but there's also another aspect that they say the requirement of vitamin D. How do you strike that balance?
Yeah, so yes, a very good question, because the best source of vitamin D for us is the sun, right? And again, the most synthesis of vitamin D occurs during the hot sun, right? So midday. So the highest amount of sun damage occurs during that time, and the best way for us to get the vitamin D is also during that time. But the requirement for somebody to be out in the sun to get a day's worth of vitamin D is 15 to 30 minutes on a normal day. So in a day like today, 15 minutes would be enough, right? So I mean, if somebody is really keen on getting their vitamin D requirement, they can be out in the sun for about 15 minutes, not more than that, right? So that is the easiest way for us to strike that balance. If you have to be out in, say, for 1 hour, after that 15 minutes you can cover yourself, right? That's the easiest.
So doctor, now another question that a lot of people who we talk to on a daily basis, including myself, I speak for myself as well, we go in the sun for about 5-10 minutes and we are completely exhausted. We're completely tired, fatigued, and sometimes you go back home and you're knocked out for a good day, just being in the sun for about 5 minutes.
Yes.
Is that normal in this during this heat wave?
Yes, I mean, this is not just a skin issue, but you see what can happen is when you're out in the sun, you sweat a lot, and sweat is not just water. Sweat is a combination of water and salts. So you lose a lot of sodium and potassium by way of sweat. Therefore, the salt balance in your body gets disrupted. That is why you feel fatigued. So, like when we sweat, what we naturally do is we will drink a lot of water, right? Water is just water, no salts are there, right? Therefore, when we drink a lot of water, now say we have lost some salts in the sweat and we drink a lot of water, so we dilute whatever salts that are inside our bodies further. That is why it's advisable to take a sort of a salt solution. That doesn't mean that you have to drink salt. The best way to do that is what we call isotonic solution, something which is similar to our blood plasma. The best solution is Jeevani, right? So
a classic.
Yes, what's called oral rehydration solution or Jeevani. So I mean, it's quite cheap. It's available everywhere, and all you have to do is buy one packet, dissolve it in 1 liter of water and drink it. And another alternative would be king coconut water or kurumba or anything like that, right? Coconut water, king coconut water, kurumba, those will have some salt, but not the ideal combination that Jeevani gives. So if you have this fatigue, try taking a bit of Jeevani and see whether you get better.
Doctor, now just to add in as well, there is another thing that people say, if I drink a glass of watermelon juice, it's equivalent to water. Is that true?
Again, I'm not the best expert to discuss
in terms
this,
of
but
skin hydration,
yes,
for the amount of salts that we lose in our skin.
I mean, if you think about juices, especially if you add water also, juices are concentrated things, right? So concentrated juices will, they are not the best to use, especially sugary juices are not the best. So it's either water or isotonic water, right? Juices are not the best for hydration, right?
Then doctor, just to talk a little bit about the importance of this heat wave coming in, we also speak about the elderly and pregnant mothers as well. What do you have to tell people watching us today who belong in that area?
If you talk about the elderly, naturally the elderly skin is dry, more dry than the skin of a young person or even a middle-aged person. And added to that is the fact that most of our elderly patients are on long-term medications for what we call non-communicable diseases, diabetes, lipid-lowering drugs, all these. So with all these diseases and the natural dryness, the elderly are more likely to have dry skin and then start itching because dry skin leads to itching. Therefore, it's good if the elderly can use skin hydration by way of a moisturizer. Right?
Pregnant mothers?
Pregnant mothers, the issue is usually in pregnancy you sweat more, and most of the rashes that occur in pregnancy are itchy. Therefore, for pregnant mothers, the sweating may be more. So they may need to, think about the sweating, be in a cooler environment. Maybe it's a good idea to wash their bodies more often if possible. And when we are discussing this, I would like to discuss about cleaning our bodies or body wash or a bath. Like these days people say, okay, I'm so sweaty, I'm so hot, I take 4 to 5 baths a day.
Yes.
Is it okay? It's okay as long as you just take a bath with water in room temperature. You just wash yourself. You don't apply a lot of soap 4 to 5 times a day because soap dries. Soap dries the skin out. Therefore, yes, what I advise people is, it's okay to wash with soap and water twice a day, maximum 3 times, not more than that. But if you want to, make your skin cool by taking an extra shower, just wash with water. Don't add soap. And because we are talking about fungal infections, make sure that you dry yourself after that. Dry yourself well. Don't allow the water to, remain on your skin. Right?
All right, Doctor. So thank you so much. Time is catching up. And thank you for taking the time off your extremely busy schedule to speak to us today, and wishing you nothing but the best.
Thank you.
All right, so I was in conversation with Dr. Indira Kahawita, consultant dermatologist from the National Hospital of Sri Lanka, and that brings us to the end of yet another edition of the Spotlight. Join me again next Monday, same time, same place. Until then, have a wonderful evening and be safe.